Good afternoon, everyone. I'm Khalid Ali, and this is my clinical assessment and intervention presentation. And my presentation is going to be on alcohol use disorder. Alcohol use disorder is a substance abuse disorder. Um, People with alcohol use disorder and substance abuse disorders, they continually use substances despite the harmful effects it has on them. People with alcohol use disorder show a problematic pattern of using um, alcohol despite how it impairs and causes distress in their lives. Like many other disorders, there has to be diagnostic criteria met for alcohol use disorder. I guess this is necessary to differentiate between other disorders and to make sure that there's appropriate treatment for the disorder. Like other substances, AUDs are categorized into severity and specifiers. The substance being used, severity of use, and specifiers make up the diagnosis to be recorded. AUD can be diagnosed as mild, moderate, or severe. For a mild diagnosis, there has to be presence of two to three symptoms. For a moderate diagnosis, there has to be four to five symptoms, and for a severe diagnosis, there has to be six or more symptoms. Um, the specifiers, however, um, have to be they are described in terms of remission. So there's early remission, there's sustained remission, and there's maintenance therapy. Um, I guess that's what Gray mentioned. However, I didn't in the DSM 5 TR, I didn't see maintenance therapy. Um, However, Gray described early remission um, as meeting the criteria for at least 3 months, but for at least 3 months, but for less than 12 months, and sustained remission um, is used after full criteria for substance use disorder were previously met, but currently none of the criteria have been met during a 12-month period or longer. And then maintenance therapy is applied if the person is taking a prescribed agonist medication, which is a drug that's capable of producing a similar response to the original drug. And none of the criteria for substance use disorder have been met for that class of medication in a controlled environment. Um, there's the differential diagnosis um, for alcohol use disorder. First, which is one, I mean, out of many, is a non-pathological use of alcohol, which can sometimes is confused with alcohol use disorder. However, it's important to remember that alcohol use disorder means that this person is using a heavy amount and then it's causing distress, among other things, among other symptoms in the person's life. So it's not enough for the person to use um, every day and using it in little amounts. It has to meet that criteria of heavy amount. Um, Again, as said, it's important to remember that diagnosis of alcohol abuse disorder requires excess consumption of alcohol that causes continuous distress and compromised functioning. Um, Also, another differential diagnosis is alcohol intoxication, alcohol withdrawal, and um, mental disorders that occur at the same time with people with alcohol use disorder. So it is, I guess it's quite common for people to experience, I guess, the morbidity for people to experience both alcohol use disorder among other mental health disorders, which could have been induced, as well as alcohol withdrawals and intoxication. However, um, the APA, the instructed not to pick one over the other. You're instructed to diagnose all of them, list all the diagnoses basically. And then I guess I did, um, I guess, a little search slash research the prevalence rate of alcohol use disorders. Um, I guess alcohol is in Gray said alcohol is the most used drug in America. Um, it is also one of the easiest to access because basically if you're 21 and older, you're allowed to purchase it, I guess, legally, but even illegally, I guess people also find it easy somewhat to have someone else purchase alcohol for them. Um, Also, according to the National Institute on Alcohol Abuse and Alcoholism, about 17 million males aged 12 and older in the United States of America um, that have been diagnosed with alcohol use disorder, and about 12 million females also that have been diagnosed with alcohol use disorder. And then looking at some of the breaking out some of like the categories, I guess, diversity apart from males and females, the spread. At 156,000 people out of this, I guess, um, combined about 28 to 29 million people that have been diagnosed with AUD. About 156,000 identify as Native Americans. Um, Almost a million identify as Asian. About 3.3 million identify as Black or African American. About 8,000 identify as Hawaiian or Pacific Islanders. Almost 90 million identify as whites. About 841 um, thousand identify as multiple races, and about 4.8 million identify as Hispanic or Latino. And then moving on to the impact of AUD on, which is alcohol use disorder, on social functioning. Um, Alcohol AUD has several consequences for people. For example, it has consequences on finances. In some research I did, I guess Collins, she described it in, he described it in a way that said, although both richer and poorer people use it, financially it tends to cost poorer people more because they have less access to resources, money, um, than richer folks. And AUD can lead to a lot of bad health outcomes, can lead to memory loss, cancer, liver cirrhosis, etc. And then as a result of this impairment, obviously it could lead to people making bad choices, which could be drinking while driving, and drinking while driving could lead to accidents. It could lead to loss of life, not just your life. It could also lead to homicide, you killing someone. Um, it can also induce AUD can also induce or worsen mental health disorders like anxiety, depression. Um, Heavy AUD slash heavy alcohol use can also damage relationships. Um, it could lead to domestic violence in the home. It could lead to abuse and neglect of family members. This could be physical abuse, sexual abuse, also sexual neglect, mental neglect, and so forth. It could also lead to fetal alcohol syndrome because, let's for example, if a pregnant mother is consuming alcohol while pregnant, um, we know that this could lead to fetal alcohol syndrome. And fetal alcohol syndrome could lead to developmental delays in children. I guess some of the theories used to explain um, AUD. There's the disease model of alcoholism. I guess in the group I work with at Highlands, one of the therapists many times always calls substance abuse a disease, and then I did read some of it online, I guess in research articles. The disease model of alcoholism has existed for over 200 years. Says that this model says that alcohol consumption alters brain chemistry and regular functioning, as already said in some of the research by the APA and Gray. It helps people view alcohol consumption and disorder as a condition that one should not stigmatize. I guess when once you say it's a disease, sometimes I guess people sort of view it as that of a disease and sometimes not as something that's under one's control. Um, However, in some sense, that has some negative consequences. Some of the researchers, including Young, um, think that that approach has made people believe that AUDs is not reversible, because they do not have control over it. While he does believe, and then some of the research believes that it's reversible. And then another theory is CBT. CBT, I guess, by the short put, is cognitive behavioral therapy. It's an evidence-based practice that's used to treat alcoholism. However, it's also used to somewhat explain alcoholism, in some sense that it's been used as a coping mechanism and sometimes as a reward mechanism. So CBT explains that that's the cause of alcoholism, and of course there are other ones like genetics and other social biological factors. But then I just picked the disease model and then CBT. So it's still building on from CBT. This is about the psychosocial and psychopharmacological interventions. CBT happens to be one of them. It tries to help people build healthier coping mechanisms, because obviously using the competency-based practice, apart from using the psychopharmacological, which has to do with more with medications, CBT is using the psychosocial approach as well, to help people um, build healthy coping mechanisms. While MI, motivational interviewing, which we do take a class on, I guess, tries to help people find internal motivations, values, to help them overcome, um, I guess, alcohol use disorders and alcoholism in general. In a research by Iman and Gross, they successfully paired MI with acceptance and commitment therapy in treating college student battling alcoholism. I guess the student who was initially ambivalent later on realized that she had a problem with alcoholism. I mean, it wasn't like a fix where she never used alcohol, but at least they did see that she became conscious of what she was of her choices, and then um, she had less instances of where she overdrank and she was drinking less. The number of times the student drank was less. Um, I guess MI also pairs well with cognitive behavioral therapy, um, which we have earlier described in Holman in the other class on motivational interviewing. We've seen that MI pairs well with CBT. Um, Also, I guess there's a debate about what the effective implementation of MI, whether there's a specific number of sessions. So most people advocate that it's just should be suited based on the client's needs. However, um, Paulson et al. Found that implementing MI intensively has better results. So basically, they said that the basic implementation of MI is usually between 1 to 2 sessions, while in their own intensive session, MI would be administered at least 9 times, or it was administered at least 9 times in the study. Um, and then they found that those who were treated with intensive MI reduced their drinking habits significantly more than women who were just treated with MI. Um, and then moving on to, I guess, the medication aspect, the psychopharmacological aspects of treating MI. And then I found the sulfiram, which is um, it's a medicine used to treat alcohol use disorder. So I guess basically the sulfiram, basically what it tries to do is make the body like kind of react differently to um, alcohol, to the use of alcohol. It makes the body have like not so friendly like reactions to using alcohol, and it sort of works like kind of like a deterrence in a way of if you use it and then your body reacts in an unpleasant way, then possibly you wouldn't want to use it at all. um I guess when if one isn't using it with if one is not using alcohol while having the sulfiram, then there's reduced effect of hangover on the body. However, it doesn't alter the brain receptors like other medications, and it does have quite a number of side effects, which include drowsiness, headaches, nausea, acne. Um, I guess it's not the most effective treatment for AUD because of a number of side effects. Naltrexone and acamprosate, I guess, were developed because as more holistic medications for treating alcohol use disorders. And then community-based resources to treat alcohol use disorders. So I guess I live in Bristol, so there's Bristol, Tennessee, and there's Bristol, Virginia. And Bristol, Virginia is in Southwest Virginia, Bristol, Tennessee is in Northeast Tennessee. So around this area, usually on the Virginia side, people are more inclined to use Highlands Community Services, which is where I'm interning at. And just having spoken to multiple therapists, in this case, my um, field supervisor, um, Highlands Community Services is a community resource in Southwest Virginia for dealing with alcohol use disorder, and not just alcohol use disorder, other substance abuse disorder. They offer both the psychosocial and psychopharmacological treatment. So they do have um, psychiatrists, psychologists that they do work with, and the psychiatrists, I guess, they offer medication services that solve the medication aspect, but then they also have groups that deal with more of the psychosocial aspect. So in those groups, they're using multiple modes of therapy. One I know they use is moral recognition therapy, which is a 12-step program. They also use cognitive behavioral therapy, which I've described before. They also use um, dialectical behavioral therapy. So it's I guess alongside also motivational interviewing. So it's a holistic approach. They are Highlands. What I read briefly online seems Frontier Health on the Tennessee side is also um, similar, basically as Highlands. They offer both the psychosocial and psychopharmacological treatment as well. And then, in conclusion, I'll say AUD has many consequences on the individual and their families. Like earlier on, I spoke about some of the financial consequences, health consequences, but that also does have effects on your family because I mean it could be due to genetics, but then it could just be due to some of the neglect, abuse that occurs as a result, or in conjunction with using alcohol. It could also take mental toll on your family and not just the person using the substances. Um, Again, AUD should be approached using competency-based practice, which involves treating human beings as a whole. I guess um, it should be approached using both the modes of therapy. I guess it should also be treated using medication, and apart from the modes of therapy, I guess, which is the advantage. I guess those modes of therapy can help process and look at some of the biopsychosocial, cultural, spiritual, um, I guess, causes, explanations of the alcohol use disorder. So I guess in summary, it's just to use the competency-based practice to both understand and both in both understanding and approaching treatments for alcohol use disorders. Thank you.